The following are types of visual object agnosia that may occur separately or together. Simultanagnosia. This disorder involves impairment in interpreting a visual stimulus as a whole. It seems to result from an extreme reduction in visual span of apprehension. Given a whole picture, the patient absorbs only one aspect or part at a time. For instance, a patient could point out individual letters or features, but cannot give an accurate account of the whole word. Lesion site, occipital parietal lobe of the dominant hemisphere. Prosopagnosia. Prosopagnosia is the inability to recognize differences in faces. Patients with lesions in the right hemisphere are impaired relative to left hemisphere lesion patients in recognizing well-known faces and in the immediate memory of unknown faces. D. Renzi and Spindler have concluded that this defect is one of the subtle discrimination and integration of visio-perceptive data and not an incapacity for grasping individuality within a category. These patients are able to recognize a face as a face and see differences in faces, but are not able to connect the face with recognizing someone. Lesion site, parietal lobe of non-dominant hemisphere. Color agnosia. Color agnosia is the inability to recognize colors such that the patient cannot pick out a color or name a color on command. This patient should be able to say whether two colors are the same or different if visual sensation is still intact. Color agnosia appears to occur more commonly after left hemisphere lesions. Lesion site, occipital lobe of either hemisphere, but more frequently in the dominant one. Metamorphopsia. Metamorphopsia is a visual distortion of objects, although the object may be recognized accurately. For instance, a chair may appear larger or smaller than it actually is. Lesion site, temporal lobe of the non-dominant hemisphere.